I'm Dr. 𝗘𝘅𝗽𝗍𝒃, head and neck surgeon at Aster CMI Hospital, Hebbal, Bangalore. Head and neck cancers are one of the commonest cancers that we encounter in our country. It's the sixth leading cancer worldwide, and about 60% of the cancers of these cancers are seen in Asia. And 30% of all cancers in India are head and neck cancers. And of head and neck cancers, oral cancers are the most common cancers that we see. About 1.2 lakh oral cancer cases are diagnosed every year, and about 72,000 patients succumb to oral cancer every year. So, head and neck cancer is usually a cancer of the upper uriodigestive tract, which involves the lip and oral cavity of the mouth, or the nasopharynx, which we call it as the upper part of the throat, or the oropharynx, so the mid portion of the throat, or the hypopharynx, which is called the lower or the bottom portion of the throat. And also the voice box, or the larynx is what we say, and the tumors of the salivary glands or the nasal cavity, and paranasal sinuses or the thyroid glands. The commonest cancer that we encounter in head and neck region is the squamous cell carcinoma, and these cancers that we encounter are usually diagnosed by doing a proper clinical examination, which involves a visual inspection, examination of the mouth, of the oral pharynx is what we say, and also the neck examination, along with endoscopy procedures when required, either a nasal endoscopy or a video laryngoscopy that is usually done. Along with a visual inspection and examination, a physical examination, we would also take help of by doing a biopsy, and also do certain cross-sectional imagings, which is usually a CT or a PET CT or an MRI scan, and certain instances even a simple ultrasound scan is of good help. Once we have diagnosed the case, then it comes as staging it. So the staging is where the imaging, the clinical examination, both are as part of the clinical staging, where this staging is usually from stage 1 to stage 4. Stage 1 and 2 would comprise of it being an early stage cancer, and stage 3 and stage 4 would be an advanced stage. So essentially, an early stage cancer would involve only a single modality treatment. It can either be with surgery or possibly radiation. And in advanced stage, it's usually a combination of two: surgery followed by radiation, and certain instances, radiation followed by surgery, especially if it has to be salvaged after initial failed treatment. And when you come to surgery per se, especially in oral cancer, surgery is the mainstay when it comes to oral cancer management, especially in a curative stage. And surgery would involve essentially three aspects. It is the removal of the tumor, what we call as resecting the tumor, and also addressing the regional lymph nodes, or the neck lymph nodes which are removed, and then also doing an appropriate reconstructive procedure. So all of these procedures are done at the same time on the same day for the patient. And then is about rehabilitating the patient with his speech, swallowing, with his chewing functions, and then also ensuring that there is a reasonably acceptable aesthetic outcome as with your reconstructive procedures that you can give to these patients. Oral cancer or head and neck cancers, what is the cause for it? If you look at the cause for it, is usually tobacco in any form, usual forms being the chewable form or the smoked form. Especially in our part of the world is the chewable form. They are available in various forms, as in betel quid or pan masala or gutka, and various other names that are there known. And the smoking form, usually the bidi or a cigarette, and also one would see e-cigarettes or cigars in hookahs in urban places. So when you have, along with tobacco use, there's also alcohol use. It would act as a synergistic effect, and the possibility of the propensity of somebody developing cancer would be that much more higher. Along with these two well-known risk factors that we have known over the years with tobacco and alcohol, there are other factors like human papillomavirus is what we say, which usually causes oropharyngeal cancers, more commonly seen in the western part of the world, and the nasopharyngeal cancers, which is caused by the Epstein-Barr virus. And the other causative agents being poor oral hygiene, or a diet which is lacking in fresh fruits and vegetables, or a weakened immunity are some of the other causative factors when it comes to head and neck cancer. And head and neck cancers, as we know, the actual cause for it, so it's at least the oral cancer is something which is a preventable cancer, because oral cavity, as we know, is an accessible part of the human body where one can think of detecting some of these cancers at an early stage. And early detection of these cancers will help us in providing simple treatment which would be cost effective for the patient, and also would amount to limited morbidity related to treatment. And the aspect of oral cancers also have something called as a pre-cancer or a pre-malignant stage, or oral potentially malignant disorders, which would essentially tell us that if not picked up at this stage, there is a propensity for these lesions to transform into a malignancy. So that's again sort of a warning sign that one would have, or the patients can also look by themselves doing a mouth self-examination, and we would essentially be able to sort of have them abstain from the tobacco use, and also have them on a regular follow-up. And once you do a proper surveillance of these patients, you can actually prevent malignant transformation of these commonly seen lesions in our part of the world. So at Aster CMI in Head and Neck Oncology Department, we have all of the services that are required in managing head and neck cancers with proper well-equipped OT and department for surgical management, and also the radiotherapy and the chemotherapy treatments, which are also essential parts of head and neck cancer management, along with a good pain palliative medicine department.